talk about your interventions and follow the money. So one key thing that stood out that almost all of you spoke about is a lack of or insufficient funding. And what Ijoma is going to talk to us about is that sometimes it's not that the funds aren't there because there's no accountability, there's no open governance. You don't actually know what those funds are doing, what they're used for, and then people don't actually go to find out. So Ijoma is looking for follow the money to code, and they have been in communities to track funds, especially income funds. So she's going to speak to us.
We can speak to running those programs.
Good afternoon, everybody. My name is Ijoma from Connected Development, Follow the Money. And we're into monitoring of funds meant for marginalized and local communities. And I'm so happy because everybody, the presentation focuses on primary health centers, and that is where our focus on health is. We focus on tracking funds meant for primary health centers and communities. And we have different ways where we do this. We first of all start by analyzing data, budget tracking, and knowing what's in the data and what's in the budget for the tracking. We've worked in several states. We've worked in Kwara State, just like I said. We've worked in Gombe, we've worked in Yobe, we've worked in so many states. And at the moment, we are working in Kaduna State. We are also working in, I can't remember the last state we're working in right now. So, but what we majorly do, we try to educate the community members that this amount or whatever has been budgeted for you in your community, and you should take it up. We do that by engaging with them, engaging with stakeholders involved, the implementing agencies, and also organizing a town hall meeting where we'll gather all of them and ask them questions regarding the funds meant for that project in the community. And so far, so good, we've been able to achieve results, and we've had impacts in communities that have been able to take up questions and be like the last one we did in just Plateau State, Lamba, Wase district. They were like, this money, they said this money is meant for us. Okay, we want to take it up ourselves. We want to go to MPHCD and ask them questions. Why are they not building this primary health center in this community? And it's something that it's empowering marginalized communities, telling them that you have to hold your leaders accountable, and that's what we've been doing so far. So if you have any questions to ask regarding how we come along and how you can how you can join us, we have a platform called ifollowthemoney.org. From there, we'll be able to support you with technical support. Yes.
Thank you, John. Thank you very much, John. Okay, so to conclude, if you've not given me your projects, please can I have it here? Okay. Your projects. So I'm going to give you 2 minutes each to talk about this project that you want to do with us after the roundtable. Okay, Dr. Shamsu, can we start with you, please?
Just 2 minutes. Just there.
My projects, we are volunteering about, though it's more of awareness about metabolic diseases, that hypertension, diabetic mellitus, and dyslipidemia and obesity, as it's increasing the body. Usually it's almost catching up with the communicable disease. So we are working on free counseling about hypertension and diabetes mellitus.
All right, thank you, Dr. Shamsu. Next, I have
Okay. I have advocacy for improved primary health care service in Kwara State, and we might be working through the Health Reform Foundation, as we have office in Kwara State, and it's going to be targeting both the supply and the demand side. We're going to be looking at the civic engagement between the two parties sides, and we'll be looking at issues of accountability, governance, capacity building, and data management, and in a holistic manner, in a way to see that, as I said earlier on, we work on health system strengthening. So to actually strengthen the health system, because we believe that looking at the 6 pillars of the health system, we need to work around that so we can actually have impact. So it's going to be an impact-based driven project.
Can you tell us a bit about your research? advocacy to reduce maternal health. Okay, tell us a bit about it. Yes.
An aspect of my project, I think meetings are very essential part in any of the project, and how we are going to implement it. I think we need to conduct an advocacy, community dialogue, sensitization meetings, and town hall meetings, including the rural community.
Dr. Shai, can you tell us a bit about your project?
There are two projects there. One is by Global Peace Women, the other one is by the Connect Health Development Initiative. Reconnect is working on a project where you want to offer free or discounted mental health services. When we draw the plan on how it's going to be, to be rolled out on our social media. But the Global Peace Women is something that has already started. There's a campaign of peace begins in the home. Someone mentioned, involving families, the whole cultural background thing. So it's an advocacy thing where we go to the grassroots. Let parents know that whatever it is, the unrest, the crisis, all boils down to upbringing of children, the whole extended family ordeal. Global Peace Women is under Global Peace Foundation. The mantra is one family under God. We don't believe there's a difference between Christian, Muslim, Yoruba, Hausa people. We're all one family under God. So if the families understand that peace begins at the home, you take care of the children, you teach them the proper ideals, then the world at large becomes a peaceful place. So that's the peace begins in the home. Then the small project is also for Global Peace Women. We found that there's a community, interestingly, AMAC in Abuja, where they don't even know what it means to brush their teeth. So we're working on working with partners. We're tasking ourselves to at least donate the toothpaste and the toothbrush. We go to that community, of course, with toothpaste companies and all that. Whatever anybody can come up with. Then we go there and let them know that this is basic hygiene. And then the dentist will also teach them alternatives, because if you donate the toothpaste and the toothbrushes, what happens tomorrow when it is finished? So the dentist will also teach them what they can use in their immediate communities for oral hygiene.
Okay, so Dr. Muje, thank you.
Yeah. On the voluntary aspect, one is just the medical outreach services targeted at communities that have just returned and they don't have health facility in their area. It's just to assemble a team of doctors and other healthcare workers, source for drugs, and moving to the town for 2-3 days and give holistic medical outreach services. So that's the
Okay. Our project is investing for impact against HIV and AIDS and sustainability. This project is currently ongoing, and we are currently working with the Global Fund as a sub-recipient under Family Health International. And we are also partnering with other SRs like Pathfinder International, who is currently working in Sokoto State. And the essence is that we at NEP1, we work at a community where we track defaulters and lost to follow-up back to care. And we also conduct demand creation for viral load testing, and at the same time for HIV and AIDS testing and PMTCT service as well. And at the end of it, because funding is going in, we also have some key activities like referral coordination meeting and biannual meeting, which is core on advocacy, where we bring key stakeholders like commissioners of health and key relevant stakeholders to discuss issues around sustainability plan and how the state government can invest properly in HIV and AIDS and take over from what has been ongoing currently.
Okay. Esther, can you tell me a little about it?
Okay. So presently, just as I said, there are a lot of projects, but I think the most immediate one is presently in Wase, a local government in Plateau, the PH center, the PHC center there, it's not accessible. Actually, the rain, what happened was the rain during the seasons, erosion, there's a big ditch that people cannot access the place. So presently they do not have, nobody can go to the center, nobody can get anything there. So we are presently working on ourselves and with the people in the community. We are trying to get a bridge using these trees and all. So we are getting the community members involved too in building a way that they will be able to cross and access, yes, the place, the facility. And that's just.
All right, Dr. Said, come and take yours.
Thank you. We have Mother and Child Enhancement Foundation, MacChef. So it's a program that works basically on women and children by way of empowering women through skills acquisition. And then from time to time they also support community outreaches to hard to reach areas. And it's a program founded by the wife of the governor. So I'm working with her and some other people, and we are trying to see how the program can be sustained beyond their duration of office.
So all these projects that we've spoken about, what we're going to do after this roundtable is send you individual emails, and we'd love to see the action plan of how we can partner with you, technical and otherwise, to come into the States and increase impact. Now we have a benchmark for the funds that we give, so it might not go as far as you want to, but at least it will be a start, and that way we can actually get more support. So I look forward to working with you on all of these projects and all these things that you've spoken about, and see how we can actually change things. I think one key aspect that we need to look at, which Dr. Saidu Sarenti mentioned, is human resources. We were supposed to have someone here that was going to talk to us about e-health, but unfortunately she wasn't able to make it. Because I feel it's very important that the health workers that we go to, we should actually trust them and be able to allow them to do their work. Now there's a bit of miscommunication or lack of understanding between communities and health workers. Like Esther pointed out, some of them don't even trust they don't have enough qualification. And sometimes you find out that even when you're talking to some doctors, the confidence you're expecting is not there, one, and then two, they talk over your head. They think you're such a layman, they don't even break down things to you. I think that is part of the issues that is laughing because we've spoken about this many times. So that's part of the issues that I feel we need to look at. Human resources. Very important. So I would love to see how your projects can actually go into tackling that issue. And then again, like I said at the beginning, innovation. We're in technology age, all of us are using smartphones. Even though in the communities that don't have, as we think, education actually are on WhatsApp and other platforms. How do we ensure that we can actually reach them? Even if we can't have a physical health center, how do we teach them certain things to make their habits different, to make their cultures different? That way we reduce the risk that they're open to, and actually the accessibility they have to healthcare facilities. So thank you very much again for all your presentations. We're going to continue outside because this room is going to be used for another event. So we're going to continue. We'll take your questions outside, but before we go out, we're going to take a group photograph here, and then we can all move outside. Thank you very much.
Thank you.